Thanks for joining us today with special guest Linda Duran, paramedic at the hospital. Linda, I understand there's a new program at the hospital called the Community Paramedic Program.
That would be a very good understanding.
Okay.
We are a community paramedic program. We describe ourselves as a mobile health unit.
Mobile health unit, okay.
Mobile health unit.
All right.
We actually, this has been in the works for about 2 years. Gerald Cantrell, who is the director of our ambulance service, and Phil Frazier, who is one of our longtime paramedics and also an RN at the hospital, have done a lot of work, a lot of extensive work and research to try to put this program together. We actually are the only program in operation as far as community paramedics go in the state of Arkansas right now.
Oh, that's wonderful.
Well,
once again, Mountain Home
cutting
is
edge.
the flagship.
That's right.
For healthcare. That's awesome.
That is right. Now, you'll find various community paramedic programs in other states. I don't know, 10, 12, 15 other states, but also overseas. I mean, Ireland and Australia and all kinds of different places where healthcare is, I guess how you would describe it is there are a lot of remote locations and healthcare is not easily accessible.
Which, same for us
Same
here.
for us
Sure.
right here. Same for us, exactly.
Makes some big challenges when you live in a rural area. You got to think on your feet and create something, which Gerald and Phil have certainly done, and you're a huge part of it.
Well, it's something that we enjoy. We have on our regular ambulance service 60, 65 employees all totaled. There were 11 of us who were fortunate enough to go through a training program that they developed for us at UAMS in Little Rock.
Oh, wonderful.
They actually developed a community paramedic program for us to learn how to take care of the folks that we wanted to take care of. So instead of being, this is kind of how I like to describe it, instead of being a reactive paramedic,
right.
We're more of a proactive paramedic, and it gives us the opportunity to spend a lot more time with some of the folks that typically we would see for 5 or 10 minutes and then not ever have any interaction with again.
Kind of go through it step by step, how it works.
Well, it's a fairly easy program to understand once you realize what we're doing. To get into the program, typically what we need is a physician's referral. We receive actually referrals from various sources. Our continuity of care department at the hospital is a huge source of referrals for us, as well as the emergency department. Once we get the physician's order to start seeing a patient, as long as we have the patient's permission, then we're ready to go.
Okay.
And typically what we do is, if the patient, say for example, is a patient in the hospital, we'll go and visit with the patient before they are discharged.
Okay.
Present the program to them, explain it to them just a little bit, and see if they're actually willing to let a total stranger come into their house and take over a little bit, which is kind of what we do sometimes. It really actually is. We like to give them, 24 to 48 hours to get home and relaxed and comfortable and back in their own surroundings.
Right.
And then we invade.
Here they come.
It's not as bad as it sounds.
Paramedics.
That's right. It's not as bad as it sounds, though. We do follow-up things such as education with your disease process, whether it be a heart attack or congestive heart failure or pneumonia or whatever your disease process happens to be. If you're not entirely familiar with that process, then we will try to come in and answer any questions that you might have and educate you on the best way for you to become proactive with your health. We'll make sure that you have all your medications reconciled. For example, you leave the hospital with a discharge packet. In that discharge packet will be an entire list of the medications that you're supposed to be taking. Some of them may be some of the same medications that you've taken before. Some of them may be new medications. Some of them may be even medications that you have taken before, but they no longer want you to take.
Okay.
So we go through your medications at home. We line them out for you to make sure that you know exactly what you need to be on, what you don't need to be on, the correct dose, when you need to take them. Absolutely, that kind of thing. We're happy to schedule follow-up physician's appointments with your primary care physician if that's something you're able to do. single help you to navigate through that system a little bit.
I know that one of the things that you mentioned too was, for instance, like educating people. And by talking with paramedics like yourself before, things that I had not thought of being non-clinical. Somebody gets home and they have some sort of heart condition and should be on a low sodium diet, if I'm correct.
Right.
And what are they reaching for? Especially some of the elderly that they want to make cooking as easy as possible.
Sure.
Head for that soup that's just
Head
loaded.
For that can of soup.
That's just loaded with sodium.
There's so many things that we think are good for us, and I don't want to get in trouble with the
juice people,
with the soup people or the juice companies. Yeah. But for example, a regular bottle of V8 juice is I think somewhere around 950 milligrams of sodium.
Whoa.
For a normal healthy person, you're looking at maybe 3,000 milligrams of sodium a day.
Wow.
For your intake. For an impaired person or someone who has a compromise of some sort, maybe 1,200 milligrams. So one bottle of juice, and that's pretty well your sodium intake for the day.
Wow. And people don't realize
they
it.
Don't.
Yeah,
they don't.
They have no clue. What else is? Just kind of stay on that if we can for just a second. What other type of things have a lot of salt in them?
Oh my goodness! Almost anything that's processed.
Anything canned, pretty much.
Mostly everything that's canned. A lot of your lunch meats.
Oh yeah.
Anything processed. Even a lot of the frozen things, with the exception of, say, for example, frozen fruits and vegetables. Those are so much better for you sodium-wise than your canned fruits and vegetables. Green beans, for example. Read a can of green beans and see the sodium level in it. Then go pick up a bag of frozen green beans and virtually no sodium at all.
So that's the kind of thing you're educating people
right.
on, that they just
it's something
never
you overlook.
had to think about, probably.
Exactly. Yeah. And fresh, absolutely. When you can go fresh, that's always best.
Yep.
Always for the best.
Yeah. So you're out there and you're helping these folks. Do you ever, with the discharge packet, it's in a folder that the patient takes home with them. Do you ever come across people that haven't even filled the prescriptions yet, or?
Very frequently, yeah. Yeah, we do. And if that's a problem, we can take care of that. There's a lot of folks around here who don't have family members who look after them, or even close neighbors or good friends that can help them take care of those kinds of things. And typically, those folks just getting out of the hospital, they can't drive.
Yeah.
They're home, and so if they have a difficult issue with filling a prescription, we're more than happy to call the pharmacist. Some of the pharmacies will deliver. We can go pick that up for them. Whatever it takes to make sure that they're on the right track to, quite frankly, keep them out of the hospital.
Sure.
Because they don't want to go back any more than we want them to go back.
Right. And that's been a huge issue with hospitals. With we're so Medicare heavy in this particular area. We are.
What are we, among the top 10?
We're in the top. We're number 5 in the nation.
Okay.
According to, there's a correlation of combination of figures that were put together, and we came out number 5. Moody's is the company that gathers all this data, and we came out 5th in the nation.
I was going to say, that's not a statewide thing.
Yeah,
that's a nation
that's
thing.
In the nation. So we are very top heavy in Medicare, and Medicare, as you well know, has put in so many rules and regulations for doctors, for hospitals. Healthcare across the board has just been inundated with items that they must stick with.
And one of those is one of the main issues that we're dealing with, predominantly dealing right now with what everybody refers to as the readmission portion.
Yeah, exactly.
That's exactly what we're doing.
Yeah.
We actually enroll a patient for 30 to 31 days into our program and do our very, very best to keep them from having to be readmitted to the hospital during this time.
Right, because what a lot of people aren't aware of, that if they're readmitted to the hospital, within 30 days of their discharge, then Medicare doesn't pay for anything.
There are huge penalties.
The hospital pays
That's
for that.
right. That's right.
And, this is a great way to get people they're getting better care by doing this. This is awesome. By doing this follow-up.
It's almost, things come full circle.
Mm-hmm.
And it's almost as if we have come back to the days of the good old-fashioned house call.
Yep.
And that's exactly what we're doing.
It is. Yeah, it's a house call, and you pick up so much when you're in someone else's environment. I mean, you're seeing probably a lot of things in a lot of areas where I know you personally have helped people tremendously. No food in the cupboards.
I'm not the only one.
Well,
we all do.
You all do. That's very kind and humble of you to say.
Well, that's what we do.
Yes. And that way you then take steps to find the support group that can help the folks.
We have so many resources, Donna, that are available to us in this area.
Mm-hmm.
It's incredible.
And people just aren't aware of them.
They are not aware of the resources that we have.
And let's talk about those as soon as we come back after a short break.
Great.
We'll talk about the resources available to you, and don't go away. We'll be right back.